Hi, I hope you guys are doing well. This is our presentation on dyslexia. My name is Christopher. This is my partner.
Andrea Molina.
Okay, so this is our presentation on dyslexia. Let's get started. So the first thing, before we get started, here's a little handout. Please scan. This has all the information on the PowerPoint. Okay, so let's get started. So, description of dyslexia. Dyslexia is a neurological learning disability that affects a person's ability to process language. Dyslexia refers to a cluster of symptoms which result in people having difficulties with specific language skills, particularly reading. Students with dyslexia also experience difficulties with other language skills like spelling, writing, and pronunciation. Depending on the severity, some students may qualify for special education, special accommodations, or support services. Dyslexia is often diagnosed by educational psychologists or specialists in learning disabilities. Experts estimate that dyslexia affects around 7% of the world's population. It affects both sexes and all races. Some characteristics and effects of dyslexia. The exact causes of dyslexia are still unknown to scientists, but anatomical and brain imagery studies show differences in the way the brain of a person with dyslexia develops and functions. Dyslexia is genetic. If one parent has dyslexia, they have a 50% chance of passing it on to their offspring. When dyslexia remains undiagnosed, children struggle to succeed in school. Some students with dyslexia may feel less capable than their classmates. This can affect their self image. Early diagnosis is key. With appropriate intervention, students with dyslexia can learn successfully and succeed in school. So, I'm going to talk about 5 indicators of dyslexia. As future teachers, we need to keep an eye out for students who may have dyslexia. Early diagnosis is key. One indicator of dyslexia might be a student who has a difficult time reading. One in, For example, this student may read slowly or inaccurately. They often make mistakes or skip words while reading. They may struggle with word recognition. They may frequently pause while reading. These may be warning signs of dyslexia. If we see this, we should report our findings to the school psychologist. Another indicator of dyslexia might be a student who has a difficult time spelling. For example, they make frequent spelling errors. If they are writing, they might spell the same word differently every time. They have a hard time remembering spelling rules. They might confuse letters. These may be warning signs of dyslexia. If we see this, we should report our findings to the school psychologist. Another indicator of dyslexia is a student who has a hard time recognizing and manipulating sounds. For example, if you ask a student to take out the B in bat, they may have a hard time saying the correct word, which would be at. You could also see a student having a hard time combining words. If you ask a student to add the letter C to at, which would make cat, they have a hard time saying the correct word. These students may have a hard time with rhyming words. These may be warning signs of dyslexia. If we see this, we should report our findings to the school psychologist. Another indicator of dyslexia might be a student who has difficulties with memorization. They might struggle to remember new vocabulary words. They might have a hard time remembering mathematical facts. They might have a hard time remembering and following verbal instructions. If you see this consistently happen to a student, these may be warning signs of dyslexia. If we see this, we should report our findings to the school psychologist. Another indicator of dyslexia is a student who avoids reading. You might see a student who never volunteers to read out loud. You might see a student who avoids all reading activities and tasks. Whenever the student works on a reading activity, they express frustration or anxiety. These may be warning signs of dyslexia. If we see this, we should report our findings to the school psychologist. Now we're going to talk about the differences between an English language learner and someone who has dyslexia. Sometimes English language learners are sometimes misdiagnosed as having dyslexia, but it's not because they have a learning disability, it's because they're learning a new language. Many times, children who are English language learners are labeled as having a disability. Uh, English language learners and students with learning disabilities may exhibit similar academic struggles, but the underlying causes are different. Students with dyslexia have an impairment in cognitive processes. EEL students are learning a new language that is different from their dominant language. Their academic challenges come from language acquisition. For example, an EEL learner might struggle in reading in English, but in their native language they can read fluently. Students with dyslexia struggle with reading in general, We need to involve educators, English language specialists, and psychologists in the assessment process. Testing will need to be done on both types of students to fully evaluate them.
Okay, so here's some instructional strategies. Technology is a great option. We didn't have that before. As pronounced as we have it now, it's more advanced. Now we have a better way to help the kids, like spell check, and they have a way to put the thoughts together. We have AI now too. So it gives them more confidence. They can do the correct spelling, and it helps the kids out a lot. Also accommodations. Not all classes are for everybody. You know, when we have a big class of a big group of kids, his kids. The kids can't focus. These kids need more assistance than others. So we can break the assignments in small chunks and provide the student an easier way to achieve their tasks and provide a fun learning environment for them. And also multi-sensory education. It utilizes visual, auditory, and kinesthetic approaches, and all kids learn the same way. So we need to take care and see how the student learns best. It has memory, learning functions, and child also learn language, and it helps them. If you go at a slower pace, the kids should be successful. Another strategy we have here is a support environment. It's well lit, it has minimal clutter and distractions, and helpful too. Addition visual aids such as pictures and colored letters or charts can be helpful. And I've done that in my teaching, and it really helps. Visual aids are the best thing for any kind of kid. And another strategy here is patient understanding. Some kids take longer than others to learn, and that's okay. And some students may need to sound out the words or visualize them to cognitive map them and develop natural pathways and help them the pupil build a permanent knee approach. And this requires patience. We need to be, as an educator, we should be aware that some kids need more help than other kids and they take longer, and that should be fine. We just have to have the patience for it. Another technology that we have here, assistive technology, is um, strategy using visual aids, like we said before, larger letters and color letters. Bingo helps. Anything that has color and brings out the kid will see the color and associate it with a letter or with a number, depending on what we're doing. Flashcards help too. Puzzles, all those kinds of different types of games online too. We have them. Another approach is software programs such as read and write goals can help students by providing access to predictions. In my center that I worked at in Sylvan, we had some kids with dyslexia, and we used to use puzzles and different colors, and the kids learned a lot from that. And also online, we have a program that would help them with letters and words and different things like that, and numbers. So these are resources, and on state level, the International Dyslexia Organization of Florida provides resources to parents. Resources are very important for parents and teachers because we both have together to make the child successful and to be able to pass all their classes. Also, learning that in the Florida and Davie areas, the mission and the vision is very encouraging, and the services that organized provide results and valuable resources and positive outlook. With the kids, you have to give the kid a push and encourage the kid to be able to it's positive reinforcements, and that's what I've learned with the kids, and that's what I need. And these are references.
All right. I hope you guys enjoyed our presentation. Um, till next time. Bye.